Thank you so much. Assalamu alaikum wa rahmatullah. My name is Ahmed Barif'a. I'm an assistant professor at King Abdulaziz University. Our project titled Low Clinical Utility of Testing for Anti-PF4 Antibodies in Asymptomatic Individuals after AstraZeneca vaccine for COVID-19 vaccine. Next slide. Okay. The research was published in International Journal of Laboratory Hematology recently, and I congratulate all the co-authors who have done tremendous work on this project in a very short time and made it go to light finally and with very useful results. COVID-19 infection was a major pandemic and still a major health concern. And WHO have allowed the use of different vaccines. The two main mechanism of actions of the vaccine is the messenger RNA vaccines, which are Pfizer, BioNTech, and Moderna, and adenovirus-based vaccines, which are Oxford, AstraZeneca, Janssen, Johnson & Johnson, and Sputnik vaccine, and there are other vaccines. VET, or vaccine-induced thrombotic thrombocytopenia, was a recognized complication, extremely rare, fortunately. But in April of 2021, flurry of reports from all over the world have reported cases of thrombosis after the receiving the first dose of AstraZeneca and also the Janssen, Johnson & Johnson, with extremely low rate, but with a very unique clinical presentation. The absence of clinical features and the incidence of anti-PF4 antibodies in asymptomatic individuals post-vaccination still was unclear. VET, initially the syndrome was called many names, including VBET, vaccine-induced prothrombotic thrombocytopenia or immune thrombocytopenia. And eventually the name VET was decided to be the agreement was on this name. So it is a vaccine-induced. So the presence of vaccine prior to the thrombosis is mandatory. It's an immune-mediated with development of anti-PF4 with close resemblance to the autoimmune HET with close timing and thrombocytopenia as well. Thrombotic complications are common. Patients commonly develop DVT and VTE. Cerebral vein thrombosis is substantially high in these patients, and splanchnic vein thrombosis as well. Thrombocytopenia, which appear 4 to 30 days. Some reports extended that to 42 days post the exposure to the adenovirus vaccine. It was not reported in any of the messenger RNA vaccines. The diagnosis of VET require the confirmation with presence of anti-PF4 antibodies, which are IgG antibodies, detectable by the usual HET assays. HET assays are ranging from point-of-care testing, which are useless in detecting PF4 with the VET compared to the HET. You see here in the panel A of the slide, the point-of-care testing failed to produce positivity in most of the patients who developed VET. ELISA assay, conventional ELISA assay for HET antibodies are very useful in this setting and has a high sensitivity and specificity. And of course, the functional assay like the SRA and HEPA assays are again useful, but showed difference between the HET where you don't need heparin to produce the platelet activation. Again, this slide showing here on the left side the ELISA assays. Different kind of ELISA assays have high sensitivity. Here, if it's visible, you can see the asymptomatic assay, which we used it in our study. The point of care testing are quite has low sensitivity and specificity for detecting anti-PF4 antibodies in patients with VET. The aim of the study was to evaluate the development of anti-PF4 antibodies in asymptomatic individuals after receiving the first dose of AstraZeneca vaccine AZ1222. The idea was during that time there were questions whether patients who are who don't have thrombocytopenia, could they have thrombosis or could they have positive anti-PF4 antibodies? We prospectively collected serum from individuals before and after 1 to 2 weeks to 3 weeks after COVID-19 vaccine with either AstraZeneca or the Pfizer vaccine. And we measured anti-PF4 antibodies using the Serochrome HEPA IgG ELISA, which is one of the commercially available ELISA assay that showed a very high sensitivity and specificity for HET or VET antibodies. We also measured platelet count, coagulation test, and COVID-19 antibodies to see if there is any correlation related to the development of anti-PF4 antibodies. This is table 1 and patient characteristic. We collected 94 patients for receiving AstraZeneca vaccine and about 35 patients receiving the Pfizer from different vaccine sites in Jeddah and in Jazan through collaboration with both universities. Largely, these participants were healthy and asymptomatic, and they don't have comorbidities. The results, we detected 5 positive anti-PF4 antibodies in participants receiving the AstraZeneca vaccine. The positivity were low with optical density ranging between 0.3 and 0.7 with a rate of 5.3%. This rate is resembling the rate of positive anti-PF4 antibodies in the general population. The most of these patients, 4 out of 5 of the participants, they had positive anti-PF4 antibodies prior to the vaccine as well. One of the interesting findings that we also found was the statistically rise in the level of anti-PF4 antibodies in most of our patients or participants, but it did not reach to the level of positivity, but was one of the observation in the study. This did not happen with the Pfizer vaccine whatsoever. So we think this could be related mainly to the adenovirus vaccine. We also did not find any relation between the development of anti-PF4 antibodies and the immune response to the vaccine, the status of prior COVID-19 infection, baseline characteristic of the participants, and also none of the participants developed thrombosis or thrombocytopenia, and most of our participants mounted a very good response to the vaccine. We noticed also a high rate of seropositive in participants who were asymptomatic. So again, this is echoing what Dr. Uthman presented, that in our population, we found lots of asymptomatic infections and natural immunity against COVID-19. In conclusion, in the absence of thrombosis and thrombocytopenia, there is a low utility of testing anti-PF4 antibodies. So we don't recommend testing anti-PF4 antibodies unless the patient is showing signs of either thrombocytopenia or thrombosis, and can be used as a confirmatory test, not a screening test. So our results provide new evidence to guide the diagnostic algorithm of suspected case of VET.